I am very proud to say this that from a mass casualty situation, mass casualty means at one incident, plenty of people get involved. With that situation, also, we could salvage patients with 85, 75% burns, and I think that was a real achievement for a municipal medical college hospital.
Welcome to Arogyam Katta. Today we'll be talking about skin bank, and to talk about it we have Dr. Madhuri Gore with us. She is a general surgeon, Lokmanya Tilak, but popularly known as a SIAM hospital. She has extensively worked into burn units. She was a pioneer in starting a concept of skin bank. Welcome Dr. Madhuri Gore on Arogyam Katta. What is skin bank and what is how does it work? That means we have heard about organ transplants. Is it something like that? That okay, you remove someone's kidney or whatever, put another man's kidney, and is it the same thing, or what's the concept of skin bank or skin donation, skin grafting?
Any bank basically means that you are storing something in that place for use at appropriate time, whether it is money or whether it is skin. The purpose is same. Skin bank or any tissue, I think it is necessary basically to understand what is the difference between different organs and skin. Organs are organs. As a whole, that organ is useful. You cannot make different slices of the organ and use it. While skin is tissue, tissue is a different concept from an organ. So, in donation of tissue and organ, there is some difference. The act that was passed in 1992 was basically about human organ donation. And organs that one can donate are many. Practically all organs in the body can be donated. But this requires certification of brain death of the individual from whose relatives one is trying to seek organ donation. While tissues are different, the tissue donation can be taken from a person who has been declared dead, not only brain dead, but cardiorespiratory death. There is a complete difference between declaring brain death, there are certain rules about that, and about cardiorespiratory death. So, any type of death, if the person is declared dead, that person can be an eligible donor for tissues, but may not be so for organs.
Does it mean that only dead? Skin can be taken only of dead persons?
Skin can also be taken from living donors, living relative donors. But one must remember that when we take skin grafts, what we are taking is the superficial layer of the skin, which is called epidermis, and superficial part of the deeper layer of skin, which is called as dermis. So it is a combination of epidermis and part of dermis. This procedure needs to be done under anesthesia in a living donor. That will leave a wound which will take about 10 to 15 days to heal. The person will have to be hospitalized for some part of that period. The person will be left with certain scar in that donor area. And most importantly, in my opinion and experience, who's ready to donate skin? Only for kids, one of the parents may be willing to donate skin. For women who get burnt, nobody is ready to donate skin.
That's okay.
Routine.
Not even husband or father.
Oh, no. I had one husband who donated skin for his wife, and rest of the family members fired him. Why did you donate skin for your wife? You would have got another wife.
It's easier.
So that is our society's attitude. So we cannot rely on living donor skins.
Okay, now
We need cadaver skin. And to preserve that cadaver skin grafts, cadaver means dead body.
Okay.
So to preserve the cadaver skin grafts, we need a skin bank.
Okay.
Because we need to store the skin grafts in the skin bank.
Dr. Madhuri Gore, you have worked so much on skin bank. What actually inspired you to get into which is not a very liked by many people to, because burn victims are very, horrible to work on. So
Yes, burns is an area which is very difficult, not only for the patient but even for the medical personnel who are treating these patients, because it does cause a significant psychological, physical, emotional strain on the doctors too. And particularly to lose a patient after struggling to salvage that person is extremely painful. But what gave me the stimulus to think about skin banking? This happened in 1991. I had an opportunity to visit different burn units in UK, in Netherlands, in Denmark.
Okay.
And in Denmark, where the skin banks were already established in Netherlands, Denmark. In Denmark Burns unit, I had an opportunity to assist in the last episode or last session of skin grafting of a patient who had 95% burns. And that patient had received skin grafts from the skin bank, and that patient went home. So that generated this thought that someday in India, in my burns unit, I should be able to do it. I think that was the stimulus.
Now tell me that the process of skin bank, skin grafting rather than the bank, I would say. Does the skin color matches? Because every person has a different color of skin.
Yeah.
So if somebody is grafted with different, as you said, a husband's skin was given for wife.
I think this is another issue where there is difference between an organ and the skin graft. When an organ is transplanted from one individual's body, dead or alive, to another individual, that is the patient, our expectation is that that organ should remain functioning in the recipient's body for long period. And that is why these patients receive what is called as immunosuppression throughout their life, so that the organ doesn't get rejected. That is not so as far as the skin graft is concerned. We know that body is going to reject the skin graft. It is a temporary but long-term cover on the area which is burnt, and so that skin is destroyed. And so it is not that each and every burn patient requires a skin graft from skin bank. Skin grafts from skin bank are required in patients who have got extensive burns. Generally, more than 40% body surface area is burnt, so that patient's own normal skin is not available to take skin grafts and put them on a deep burn area. In such cases, the skin grafts from the bank are utilized to save the patient's life, to improve the nutritional condition, to improve their immunological response, and to control infection, which is very essential. Otherwise, the patients may not survive.
Now, is leukoderma issue solved with skin grafting or
No, leukoderma is not
separate?
an indication. It's a completely separate
Separate
condition,
topic doesn't deal
and
with
no,
skin.
and not the
No, no,
answer is
I
not
just thought
cadaver skin graft.
because it's a skin disease.
Yeah.
So skin grafting is not done for skin diseases.
No,
It's essentially for burn patients.
for burn patients or for other type of wounds also, one can use skin grafts.
Okay.
As a temporary measure. Because that's what was our point actually. That are we interested in matching the color of the skin? We are not. Because that skin is not going to remain on that area permanently.
So you are temporarily masking the.
We are temporarily helping the patient, one, to achieve healing of that wound under the graft, and for other purposes that I have already mentioned. It is not a permanent cover. It is not going to remain on the patient's body permanently. So no color match is required for this particular kind of skin grafting.
Does scar remain? Because that's
If
original skin will.
As we said that this we are talking basically about cadaver skin donation. There is no this does not apply really. On a living donor, yes, the scar will remain if a skin graft donation is taken.
That's why normally it's done from unexposed parts like thigh or
thigh, but the scar does remain both in a living donor as well as in the patient where we are using what we call as autografts. That means taken from the same individual. The scars do remain.
Are artificial skins available?
Yes, very expensive, exorbitant, very expensive.
Are they available in India too?
If one is ready to pay.
How much? I mean, normal.
I'm
just giving a.
Oh yeah, but I am also ignorant about the exact price of that. But I think there is one very important social aspect that we should understand. Majority of the patients who receive burn injuries are from poor socioeconomic class. And so we should understand that these patients cannot afford very expensive treatments. And over extensive body surface area, it becomes exorbitantly expensive.
Now, with your experience, can you tell some percentage of how many burn victims are there which are out of domestic violence versus the industrial accidents or roadside accident? I mean, roadside accident, the question of burn doesn't arise.
Unless the car catches fire and somebody gets burned.
But domestic violence is it a main reason for one of the main reason, or what are the causes which?
In pediatric age group, usually burns are seen in toddlers who are very inquisitive and they try to pull things. And they might pull a utensil which is containing hot liquids which falls on the child and the child gets burnt. Or the whole house catches fire, and this happens pretty often in particularly hutments where a lamp is kept at night. The lamp falls down because of rats running around and everything catches fire. Uh, if you talk about burns in males and in females, it will depend on from which area of India you're getting the statistics. Because areas which do have in multiple industries, males get burnt more often because the problems are happening in industries. While in the rest of the areas, females are more likely to get burnt because of multiple causes. The real cause you rarely come to know because the female concerned always tries to protect her family, her husband. So the statement that she gives is not really the truth.
Okay. Now, do you have anything to say? I remember you reading somewhere about you that banana peel has been used for. I don't remember exactly what, but what was it?
First, let me correct you. It wasn't peel.
Okay.
It isn't peel. It is banana leaf.
Oh, leaf, not the skin.
Not the banana peel.
Okay.
Yes, I developed that banana leaf dressing at our burns unit at San Hospital. The basic purpose being that the dressing should be very, very cheap. The dressing should cover large areas. The dressing should be quick to do. And the dressing should give a cooling effect on the wound so that the patient has comfort and less pain in removing as well as while having the dressing. And I'm happy that even today it continues to be the cheapest dressing in the world and the easiest dressing to be prepared and can be prepared by
Is it a
anybody.
global phenomena that they use
Uh, Global, I don't think so, but
okay.
there are at least 4 or 5 countries that I know that are using banana leaf dressing. Bhutan, Nepal, Tanzania, Australia. There are reports from all these countries of using banana leaf dressing after we reported results of our study.
We are coming on the end of the question session. Do you have anything to say which we have missed in our conversation? Because many times we miss certain points. So do you have to, on your own, want to talk or something about what we have missed?
I think I would like to stress the point that cadaver skin grafts do save lives, and that's our experience at the unit too. At one time, when I started looking after the burn unit, the general percentage of burns, which is the body surface area that is burned, that could be saved was just about 35% of body surface area.
Mhm.
And with all our efforts and then starting the skin bank, we reached a stage where we could start saving patients who had even 65% body surface area burns. And in fact, I am very proud to say this that from a mass casualty situation, mass casualty means at one incident, plenty of people get involved. With that situation also, we could salvage patients with 85, 75% burns, and I think that was a real achievement for a municipal medical college hospital, which is generally kind of looked down upon, unfortunately. So I do think that one should seriously think of pledging skin donation after death. But just pledging the skin and filling a form is not enough. It is very, very essential that your close relatives are informed about your wish and your close relatives should agree with your wish because according to our law, our body becomes property of our next of kin. So one might fill a form and express the wish to donate skin, body, whatever. But it is not necessary that it will happen unless the relatives are convinced about it.
I never knew about this aspect
yes. It's very important. There have been examples where body was donated, a very, very well-known politician, but the relatives refused to donate the body after death.
Okay. And they were right.
They have the right. They have the legal right.
Legal right.
Yes.
But thank you for giving an insight of.
I hope that this helps in creating some awareness about cadaver skin donation.
Let's
hope so.
And now I'll be asking you some. I'll make some statements, answers of which will be yes or no. Very briefly. It won't be a long answer. It will be a very brief answer is expected.
Yeah, because all questions may not have only yes or no answer.
No, it can be brief, but not. We don't expect a big elaborated. Elaboration.
Fine.
Just a sentence or two.
We'll try.
So, can I start now?
Sure.
Skin donation plays a major role in helping burn victims.
Yes.
Skin donation is similar to organ donations.
No.
Skin can be donated after death.
Yes.
Skin donation is painful.
No.
Yes
We
or
are
the
trying to promote from a dead body.
dead body. Receiving donated skin has minimal risk.
Yes.
There is adequate public awareness of skin donation.
No.
People can register online to become skin donors.
I don't think online donation would, wish is right now present, but a form can certainly be filled.
Donated skin can be preserved for ages.
Not ages, 3 years.
Donated skin can be used immediately in emergency situations.
After certain tests,
Skin banking is still a new concept in India.
it is.
Skin banks are currently facing shortage of donors.
Yes. Uh,
Skin Bank operates as a non-profit organization.
mm, at least the expenses towards processing of the skin grafts need to be recovered. And this is done by most of the skin banks which are placed in a private setup. In municipal setups or government setups, this may not apply.
Skin Bank collaborates with hospitals across India.
Different states,
Artificial skin can sometimes replace a natural skin.
if affordable,
Donated skin can significantly improve the quality of life.
certainly.
Skin Bank services international patients.
Not at present.
Are there any
Though there are skin banks in the world that do provide skin to other countries. The most important one, probably doing great work and which was a stimulus for me, was Skin Bank or is Skin Bank at Beverwijk in Netherlands, which provides skin to whole of Europe.
Are there any cultural or ethical issues about the skin grafting, donation, or whatever?
I haven't faced any.
Skin transplant is expensive.
Not really.
So, thank you for coming on the Arogyam Katta
Thank you.
and answering all the
Thank
questions.
you. Thank you so
Thank you
much.
very much.
अगर आपको ये वीडियो पसंद आया हो तो चैनल को सब्सक्राइब करें और लाइक करना ना भूलें। अगर आप किसी विषय पर और जानकारी चाहते हैं तो कमेंट में लिखें ताकि हम आपकी पसंद की वीडियो बना सकें।